Okay. Hello again, everybody who's not in here. So I'm Dr. Shadi Arafid, the owner of Vet Triage, board certified surgeon. We're going to talk about dental disease. and, it's just it's a continuation of common issues. I hear a lot of myths and things like that with dental disease, and it's pretty straightforward ordeal, but let's go through it. So, um, dental disease in animals, you can compare it to that of people. They get gingivitis, they get calculi, they get tartar, they get root infections, all that stuff, right? But of course, the hygiene in animals for dental care will not be up to par like it's expected to be for human beings, and so they will frequently have dental disease. It's very, very, very common, and we're focusing on domesticated animals, dogs and cats, let's say. But you can imagine wildlife and things like that. It's they have no way of having dental care beyond natural methods, of like eating on roughage and shearing their teeth on things to take the tartar off. But anyway, besides the point, for your dogs and cats. So think of it in terms of dental disease in people, where part of it is genetic and part of it is environmental. We all know folks that can eat all the candy in the world and never get any cavities, and we also know people that just look at candy and they've got cavities. And so there's a genetic component to it, and there's an environmental component. Environmental meaning your your habits. How do you eat? What do you eat? How do you take care of your teeth? Things like that. In animals, it's probably a large part of it is due to genetics. We certainly see certain breeds that are more prone to dental disease than other breeds, but it doesn't really matter. Any dog or cat can get dental disease, and it can range from minimal every year to severe, and just depends on the pet, and so their genetics, and then depends also on how you're taking care of them. There are preventive measures for keeping teeth healthy, and we do have veterinary dentists in the field. They are rare to come by in the United States, but if you're looking for expertise beyond your family veterinarian, then having a consultation with a board certified veterinary dentist is not a bad idea at all. They're really good at this. But anyway, preventative measures would include things like trying to feed your pet kibble, so harder substances more than canned food. The idea there is that the friction from the kibble, as their teeth are chewing on the kibble, creates a force that can remove calculi, and so it's basically the equivalent of us brushing our teeth, where it may be more of the mechanical motion of the toothbrush on the teeth rather than the actual toothpaste itself and what's in it, as far as removing calculi and debris and food particles, that kind of thing. So part of it is feeding your pet kibble, and then secondly, there are chews, there are dental chews. Some of these dental chews, they have the same idea. They're the consistency of rawhide, so it entices your pet to chew on something to get that mechanical abrasive forces going to remove the calculi. But with dental chews, sometimes they also have enzymes in them that can help further break down calculi on a more molecular or chemical basis. So that's also something else to consider. There are, I think, I've looked at oral rinses for animals, so products that you can put in their water that are safe to ingest, and because obviously dogs and cats can't gargle or anything like that, so so you can put stuff like that in the water that's safe to ingest. That'll hopefully maintain oral health as well. um, and then finally, before we get into actual dental cleaning, does your dog or cat allow you to brush their teeth? Not every animal is amenable to that. Probably most of them are not going to tolerate that. And you have the added problem too, even if your pet does tolerate it, well, what's the structure of your pet's muzzle? If you have a long-nosed dog, it's going to be very difficult for you to be able to get back and the upper and lower arcades for those premolars and molars. And a lot of dental disease occurs back there. So just the anatomy of your dog's face, their maxillofacial structures can be inhibitory to your ability to thoroughly clean them with toothbrushing, even if you have a well-behaved dog that'll tolerate it. So those are some ideas for preventive measures. If you look at dental cleaning in animals, the theory that you can perform a thorough dental cleaning in an animal that's awake is just untrue. Dogs and cats will not tolerate the scaling and polishing that you have to do in order to remove all that calculi, that tartar, those food particles that's built up over weeks, months, years, depending on how often you're getting the teeth cleaned. There's no way they're going to sit there and handle that. And not only is it uncomfortable, it's also loud. There's vibrations involved. There's lots of water involved as well. So we can flush out the mouth while we're cleaning. There's so many reasons why it's a bad idea and not realistic, not practical to do it while they're awake. And so any dental facility or any veterinary facility that claims they can do anesthesia-free dentals is just not true. Now, if you're talking about general anesthesia versus like sedation, like light sedation or heavy sedation, the reason why we advocate for general anesthesia is, number one, the patient is reliably immobilized, so you can do the cleaning thoroughly, completely. But secondly, and probably more importantly, you protect the airway. There's a lot of debris that's going to aerosolize when you're cleaning the teeth. Bacteria, all that stuff is going to be airborne. And also there's a lot of, like I said, fluid that's going to be coming from the dental equipment to help flush out the mouth. And you don't want to risk those things getting into the respiratory tract, into the trachea and lungs, and predisposing them to pneumonia. So you need to protect that airway. So when the dog or cat is under general anesthesia, they're intubated. So they have that tube, right, which connects them to oxygen and gas for the anesthesia. And it protects their airway from all that crap that you're removing from their teeth, and it protects them from the lavage, the water, the saline that we're using. So general anesthesia is the way to go. If you have a pet under light or heavy sedation, you may not need to intubate them, which a lot of pet owners are afraid of. But the problem is you are risking aspiration, which is the process by which these particles, bacteria, debris, water get into the airway, and they settle in the lower airway and cause pneumonia. And you also are now fighting against time, because the sedation is going to wear off. And can you finish a dental cleaning before the patient wakes up? So even if they're claiming, oh, we're anesthesia free, we don't do general anesthesia, we do like sedation, even that I would say is not ideal if you're going to clean the teeth appropriately. So focus on dental cleanings that require general anesthesia. And then from there, once the patient is under anesthesia, there are some decisions to make. Does that veterinary facility have the ability for dental radiographs, so dental x-rays in people? Of course, dental x-rays are a big deal, but it's obviously easier to position a person's mouth. You know, they put that thing in your mouth where you have to bite down and different positions with your tongue and whatever else. That way they can get the optimal views. And animals are under anesthesia, and of course they've got long snouts, most of them, and so a lot of them. And so dental radiographs, if they're even available, can be fairly hard to collect and difficult to interpret, but still it's the ideal way of doing it. And so ideally they have dental radiographs. Now it is also up to you, the pet owner, whether or not you want to invest in dental radiographs, because at the end of the day you still need the teeth cleaned. And it's also up to the veterinarian, you know, how beneficial is that for that patient? If you're doing a dental cleaning on a 6-month-old dog, what are the chances that there's going to be a deep-seated root infection, or a tooth that's fractured or has to be removed or whatever? And so, you know, it kind of depends. But if you're talking ideal, every patient would receive dental x-rays before the procedure starts. Once they collect the x-rays, the veterinarian evaluates them, determines whether or not there's anything sketchy there. Is there any bone infection? Are any of the teeth fractured? Are there any tumors? in the mouth that we're not seeing on oral exam, things like that. And then they'll start the cleaning. The cleaning is going to include scaling and polishing. So they're going to use an ultrasonic probe, and it's going to remove a scale and remove the calculi. And then after that's all done, they'll polish it to get rid of all those micro grooves that were in the teeth from wear and tear and infection and whatever else. And if your vet feels that any of the teeth are questionable in terms of health, hopefully discussed ahead of time with you that they have the ability, with your permission, to remove any teeth they think are not viable or not healthy or infected or whatever. And so it's up to the veterinarian to decide whether or not teeth have to be removed and how many and all that. And it's a judgment call. It's a judgment call. Sometimes there's obvious reasons to remove teeth. They're fractured, they're clearly infected, they're discolored, they're causing pain. The bone underneath the tooth on the x-rays is being affected. It's unhealthy, there's infection, whatever. And so they remove the teeth. Overall, this is where you can't really compare animals to people. For people, removing teeth is a big deal. It's cosmetically, it's massive, and of course, it's going to affect your ability to eat food and stuff, and certain foods anyway, and you have to chew on one side or whatever. With animals, they're just going to adapt. They don't care about cosmetics, so it's not as big of a deal, let's say, to remove teeth in pets, but we consider it a big deal in people because it is a big deal for us. So let the vet use their judgment to figure out the best course of action to take for your pet's teeth. And then after the extractions are completed, then they'll wake your pet up and hopefully you can go home. And that's the basics regarding dental care in animals and dental cleanings. Now, how often do you have to perform a dental cleaning? Well, it depends, again, on your veterinarian's evaluation. That's going to be performed annually if you're following through with yearly checkup with your pet. If you have a geriatric pet, older geriatric, then we usually recommend biannual examinations, twice a year. But really, it comes down to, again, genetics and environment. There are some dogs that can maybe get away with not having cleanings done every year. And there is some that by the time they get their biannual exam, they're ready for more because they built up so much tartar from the previous dental cleaning. Not from the dental cleaning, but since then. So it really does depend. Not every pet should be a slam dunk, need a dental cleaning. It should be evaluated by your veterinarian, determine whether or not it's indicated. And then, of course, what level of safety or concerns there are. If you have an older pet with comorbidities, he's got heart murmur, heart disease, he's got diabetes, he's got cancer, he's got thyroid, whatever, then is it worth the risk? And we know that severe dental disease not only causes pain and declining quality of life, it also causes infection. That infection can stay localized to the mouth, or it can seed into the bloodstream, affect other organs. This is true in people and animals. And so you have to weigh the pros and cons. Is it worth the risk of dying under anesthesia for a pet who's debilitated? No, probably not. You'd probably rather live with oral pain and infection than be dead. But other than that sort of extreme example, what are the risks involved? Is it worth it? What do you do? And that depends. That's up to you, the pet owner, and discussion with your veterinarian and their comfort level with your pet's medical history and all that stuff. But the standard risks are there for general anesthesia. It doesn't matter whether you're performing a dental procedure or a spay or spine surgery. It doesn't matter. The risks are there. Some pets are minimal to almost no risk. Some are high risk. Some need the dental because the quality of life is so bad that it's worth even the risk of death because they're miserable. They're not eating. They're drooling all the time. They have horrible smelling breath. It's just, there's a chance that it's going to be a full mouth extraction, meaning removing all the teeth of the mouth. It's just a nightmare, and it becomes a quality of life issue where this pet owner might be considering euthanasia. Well, then maybe it's worth trying a dental, even though this patient might be high risk. So those are conversations to have with your veterinarian. And I think that pretty much wraps this up. We'll figure out a topic for tomorrow. Today's Friday, June 7th. And for those of you who are wondering about this T-shirt, it's a bit odd. It's got a can of whipped cream and then the breast cancer symbol there, and then of course whipped cream and cherries. We did a 5K race in Central Park in New York City many years ago, and I did it with one of my with a few of my interns actually in New York. And one of the interns, that was the reason why we did this, is because it was a breast cancer run, and she was a breast cancer survivor. She went through surgery, chemo, radiation. Won't mention her name in case she doesn't want that disclosed, but she made shirts for us, for the team, for the race. And so this is what this race, and the back of it says whipping cancer in the butt. So whipping, got it, whipping. Anyway, that's why all this is here. So just in case those were wondering about this shirt. Anyway, thanks so much for attending and watching, and please feel free to donate, spread the word, hit like, subscribe, spread the word, all that stuff. And we'll see you in the next video. If you have any suggestions of topics you want, just throw them in the comments and we'll take care of you. Talk to you soon.